My name is Joseph Herbert. I am Associate Professor of Neurology at New York University Medical School. I'm a neurologist with specific interest in multiple sclerosis and neurological rehabilitation. In my opinion, what makes a good doctor is a knowledgeable, humane, and empathetic individual with good communication skills. The recruitment process and the hiring process for doctors in the US differs between private practices and institutions. Here we have the advantage usually of having human resource departments who screen a lot of the resumes and candidates and will refer to us people who they think might already be appropriate. I then have my own particular style of interviewing and deciding about candidates. For a doctor in a resume, you need to explain and state clearly what your training has been. You need to explain carefully if there are any gaps in your training or in your employment, and you need to make a clear statement as to what it is that you are aiming to do. People need to know who you are and what your professional goal is. What I'm looking for when I'm interviewing a candidate, firstly, are the most important considerations. Is this a decent human being? The second thing I'm looking for, and the question I always keep in mind is this the sort of individual that I think would serve as a good bedside doctor? Is this the kind of person who would be able to explain to me details of my illness, would be able to talk to a family member and to communicate properly with them? These two components are more important to me than their academic qualifications, their grades, the research that they've done, because these are the human face-to-face issues which you cannot really quantitate. To me, it's very important to actually meet the candidate and note these subtle interactions, which might be a look in the eyes or it might just be their body language, which tells me if this is the kind of person that I think intuitively is going to be a good match for our particular practice. Before deciding who we're going to give the job to, it's always very important and helpful to call the references. Sometimes I can't get a read on somebody. They're reticent, they're modest or shy in the interview, and I just don't quite know if this is the kind of individual I'm looking for. A phone call to one or two of the references usually will wrap that up in a couple of minutes. And what I'm looking for, obviously since these are provided references, they're going to say good things about the person. But what I'm looking for, once again, is that little bit of enthusiasm, a word or a sentence that tells me that this person has something special and that this has been noted by the reference. If a reference says to me, this is a true clinician, or this is somebody whose patients responded excellently to him or her, then I know that I've found the right candidate. For a new doctor after graduation, I would say listen very carefully to your patients and address what your patients are saying. These days people tend to specialize earlier and earlier, and even if you want to be a general physician, that's a decision that you need to take fairly early.